answer I could give to that question.
Yeah. Have you ever collaborated with a dentist before in patient management?
Okay, so honestly, I have a sister and she's currently working as a dentist, my profession as well, currently in Bantayan Island. But so far, honestly, I haven't really collaborated with any medical professionals, specifically our dentists in patient management. Even for my sister's practice, I haven't seen her referring from her as a dentist to the medical doctors, but a dentist to a dentist referrals. Not yet.
Okay. So that also means that you haven't been collaborated with a dentist in any other means aside from patient management?
Yes. Now, honestly, I'm still in PGI or postgrad intern. But as I observe with the doctors here, our residents or consultants, I haven't really seen management from a medical doctor to a dentist. So that not yet. Also.
But in your, for you, how do you think your profession as a medical doctor could have a connection with a dentist?
Actually, we really have this interconnectivity between the medical doctors and the dentist, even though I haven't observed yet. But theoretically, in the past, I've also known that there are really, oral infections are one of the most common causes of diseases. And I've seen and I've observed in the OR before when I was still a clerk, there were oral health problems, there were oral infections, there were tumors, masses orally, and then it was managed by surgeons and doctors. But I think that's the only one time where I really observed, and then from that experience, I could really say we really have interconnectivity. It's just that maybe not just superficial, but on the how do you say this? But on the deeper level now where it's more serious. Because I believe that in superficial problems or health, the dentist could manage them easily if it's a deeper level.
Thank you so much, Dr. Bell, for sharing your knowledge with me today. Thank you so much.
Thank you so much for having me.
Hi everyone, we have here Mr. Evan.
Hello.
Mr. Evan, would you like to introduce yourself with us?
Okay, sure. My name is Rael Relvin Oriol. I'm a registered pharmacist. I graduated last October 2019 at Southwestern University of FINMA. I'm currently a hospital pharmacist right now, which I have experience also in community as well.
Sir, I would like to ask you things about your field of work, especially your collaboration with dentists. So, as a pharmacist, sir, what do you think dentists do?
Okay, so for me, the main impression for me about dentistry is I think they are, no, not I think, but I'm sure that they are the one who are frontline in the good oral hygiene of the patient. They are the ones who create beautiful smile to our patients through constructing the decayed tooth or having Bell's pasta and also doing root canal and all those procedures that I know also only dentists would know. So those are my impressions and those that I think what are the dentists doing. Sure.
In your experience, sir, as a pharmacist, have you collaborated before with a dentist in patient management?
Yes, actually, I do remember when I was still working at 360 Pharmacy as a community pharmacist, there was this patient who gave me this prescription, and the prescription, the signal of the dentist wasn't really that clear, or as we all know, the handwritten. So what I did was I called the clinic. I did clarify the route and the frequency, and also the dose of that antibiotic per se. I can't remember what antibiotic it is. So luckily the dentist was there. She explained, she just clarified it to me. And that way it helps me to dispense the correct antibiotic and correct dose of the patient. And also I just did short counseling for the patient as well, like that.
Aside from that experience, sir, that was a nice experience. Have you collaborated with a dentist in other means aside from patient management?
Yeah, I do. I do have a lot of friends when I was still in college, dentistry student, dentist as well. I do remember since we pharmacists are more likely, we tend to know more and specifically about pharmacology. So there was this topic about anesthesiology, which is very vital, I know, in your field of work. So I just did explain them in a way that they would understand it. They would appreciate the mechanism of action, the whole thing about dose calculation, about pharmacology, about anesthesiology, and also I think that I also did explain to them the antibiotic, also which is very important in their field, to know the other generations about antibiotic. So yeah, in that way I did help them.
For your last question,
Okay.
Mr. Raven, how do you think your profession as a pharmacist can work with a dentist and a patient?
Okay, that was a nice question. No? I would like to clarify that the role of pharmacists in healthcare is mostly on the dispensing and counseling side. No? That way, we could help the dentist in the dispensing process process of the antibiotics or the medicine that they prescribe, and also counseling their patient, because we would like to assume in our part that maybe the prescribing physician wasn't able to really explain it clearly to the patient, the dosing, the signa, as well as we say about antibiotic or the medicine. So I think it's in our part. It's our responsibility to counsel the patient, or in order for us to help the patient to abide with the medication, to use them properly. We do believe in pharmacy that we have this 5R with the right patients, right dose, right time, etc., etc. So in that way, we could assure that the medicine could really give its optimal effect and benefit to the patient, especially antibiotic. As we all know right now, the antimicrobial resistance, I think it's very vital for our healthcare for us, a pharmacist, to explain it to patient. So I do think those were the ways that we could help you, dentist.
Thank you so much, sir, for sharing your knowledge with me.
Welcome.
This is such an honor. Thank you so much, Mr. Raven. Thank you, sir.
Thank you.
Worked in Southwestern University, FINMA, as a faculty and clinical instructor before. So I stopped last July because I need to find myself here in Australia. So I'm already here in Australia. But I'm also processing my documents and did my registration so that I can practice as a fully licensed physiotherapist in here. But I'm not yet licensed in here. Yeah.
Okay, Miss. In your experience as a physical therapist, Miss, and in your observation, what do you think do dentists do, Miss?
Dentists do the overall care of the oral health. So you are the ones who are responsible for our teeth, and not just the teeth, but the overall head and neck. Because I've been teaching you guys the anatomy of head and neck, so I know that most of you are masters of it. And not just the teeth, but also the joints, the muscles, and even the muscles in here, that involves swallowing. So you are the ones who are responsible for it. So it is important for us to know all of that as well, because we are not, me as a physiotherapist, I'm not that knowledgeable enough to provide like what you guys provide, because you are masters of your field. So I am also master of my field. So
Okay, Miss. As a physical therapist, Miss, in your field of work, have you ever collaborated before with a dentist on a patient management?
Yeah. When I got my license, up until now, I haven't been collaborated with them. But I do remember when I was a student, when I did my grad ASCON when I was assigned to a grad case conference with a patient in Sumen. I did collaborated with them, but just a tiny bit of information because I just took a tiny bit of information because it is also important for us to know the nutritional health of the patient. So but sa ako ang kuan niya na license na ko, wala ko naka-collaborate nila.
Okay, Miss. Aside from, since you haven't been collaborated with a dentist on a patient, in patient management, how about on other means, Miss? Have you collaborated with them on other means, like, in any other means?
In any other means, like, I think because if the patient has problems with dentures, some things like that, I have also treated patients with problems with TMJ joint, and at the same time swallowing difficulties. So I think in other means, I did, but not directly. But I know that dentists can also do types of management na pwede nilang i-apply sa katunga sort of dysfunctions. Yeah.
Okay, Miss. And for the last question, Miss, how do you think, as your profession as a physical therapist, can work with a dentist, Miss, in a patient? Like, what do you think are the help or the connection between the dentist and you as a physical therapist?
Yeah. As a physical therapist, we are actually known as masters of movement. So we are actually major movements of the body. So we deal mostly the major joints and major muscles. But we also deal with smaller joints, just like I've mentioned before. I was treating one of my patients has TMJ joint dysfunction because of traumatic brain injury. So it also affects his face, and not just his face, his joints in here, his muscles particularly, and then because of the weakness of the muscle, it affects his joints. And at the same time, he also has swallowing difficulties. So it is actually important for us to collaborate with dentists, because if our patients have problems with the problems I mentioned before, they will also have problems with eating. And if they have problem with eating or food intake, they will have less energy. So if they have less energy, it will be difficult for us to encourage them to move, because they will be feeling weak, and at the same time, hindi sila ganado mo lihok, diba? So it's actually important for us to take note of the patient's nutritional health with also help of the dentist. So
Yay! Thank you, Miss. Thank you for that, for sharing your knowledge with me, Miss. Thank you so much for tonight. Thank you, Miss.
Okay, thank you,
Yay.
sir.
Good evening, Miss Antoinette. Can you please introduce yourself?
Good evening, Ma'am Apple. I am Antoinette Tagbe, and I'm a registered social worker.
Field of work, Miss Antoinette. In your observation, what do you think do dentists do?
As far as I know, dentist is responsible for the oral health care of the people.
Your experience, Miss Antoinette, as a social worker, have you ever collaborated with a dentist before in patient management?
Yes, because tamang lugar is na ginatawag na program Bayugan on Wheels. This program is kanang there are barangays here in our city na dili kay sila ka-access sa kanang programs and services na gi-offer sa government. So what they do is those agencies, sila mismo mo to sa mga barangays to offer their services to the people, and one of their services is we link some dentists to provide awareness to the mga especially sa mga children nga it is very important oral health care is very important. Na mga services po na gina-offer like libre nga bunot or libre kata.
Okay, that's so nice. That's so nice to hear that your city has been doing that. Taga-Bayugan pa ko, ma'am. Classmate data sa una, ma'am. Then, okay, that's so nice to hear, Miss Antoinette. And for the next question, aside from patient management, how about in other means, like not in a patient management, but have you ever collaborated with a dentist in any other ways?
Actually, one of the role of our profession is we call it a social broker, which means kanang we link our clients to the other agencies so that kanang maka-access bitaw sila sa mga mga services like naay mga client na dili sila aware about oral health care kay because dili sila maka-access, wala sila money or actually before we mag-conduct mi og case study is mag-ano sa mi sa biopsychosocial sa amo ang client. So kanang among i-assess kung nganong dili sila maka-access ana nga mga services. So among tan-aw kung unsa ang mga problems nganong like financial problem or kanang layo ba sila sa sa mga facilities. So what we do is we seek help from the government agencies nga unsa ilang mga available programs and services nga ma-offer sa mga those kanang mga less fortunate individuals nga makaano sila sa mga services, maka-avail sila sa services. So
Miss Antoinette, as a social worker, in your experience of work, how do you think you as a social worker and a dentist can work together? I mean, what is the link or the connection between the social workers and dentists?
actually, kami nga mga social worker is nami ginahandle na community or barangay and we can work with a dentist like naman yung mga places or just like sa among ginahandulan ng mga community nga ano jud siya daghay mga less fortunate or kana ang dili sila aware about oral health care or wala jud sila kanang alamag about ana ingon ana. So nami ginaano nga especially sa mga children bitaw kay di ba sila jud ang kanang murag dapat nato pagtuunan kay so pwede pod is kanang mag-conduct me og survey or mag-assess me kung kinsa tong mga need og oral health care and then pwede na mo sila i-refer sa mga dentist nga ga-offer pod og free consultation para sa mga less fortunate individual or less fortunate communities or pwede pod maga-invite me og mga dentist na mo adto sa among community to conduct a program or like oral health care awareness.
Okay, Miss Antoinette, thank you so much for sharing your knowledge with me as your profession as a social worker. It has been an honor to interview you. Thank you so much.
Thank you, Miss Apple.
Since Doc Herv Ibon is a camera-shy person and I respect that, I will just be posting here the screenshots of our conversation and her answers to the questions. Here on the first screenshot, I asked for a permission if I can interview her, and fortunately, she agreed. And here on the second screenshot, you can see that she requested if she can answer through message, and since I respected her decision, so I told her that it's okay. Here I asked the first question: as a psychologist, what do you think dentists do? And Doc Herb's idea of dentists are doctors who specialize in oral care, treating problems with patients' teeth, gums, and other parts of the mouth. And they also provide instruction on taking care of the teeth and gums, remove decay and fill cavities, and repair or remove teeth that are damaged. They also diagnose oral disease. And with this screenshot, I asked her if she's been collaborating with a dentist in a patient management, and she said that she's been collaborating with dentists as a chief marketing officer in their family or medical dental clinic, that is Ibon Dental Clinic or Ibon Dental Society. And on the third question, I asked her if she's been collaborating with dentists in other means, and she said that she tried, but as a psychology major, she thinks that it's hard to work with dentists with her kind of specialization unless she'll just check the patient's blood pressure. And in this last screenshot, I asked her if how she thinks her profession as a psychologist can work with a dentist and a patient. And she thinks that dentists and psychologists can work together to identify and treat a patient's anxiety and phobias to enable patients to obtain the dental treatment they need. And after doing an interview with her, I thank her for sharing her knowledge with me. After interviewing various professionals of varying fields, I come to realize the importance why we are studying this subject, the interprofessional approach to patient management. I think this is because I found out that we still lack in implementing this kind of approach to patient management. Because although there are situations where dentists and other professionals come into play or collaborate, actually they unknowingly do that. For example, is with Sir Revan, the pharmacist that I interviewed. He told me that he thinks that he collaborated with a dentist in a way that he is responsible for dispensing the drug that is prescribed by the dentist, which is actually correct. And you see, they are unknowingly doing the collaboration because or the collaboration is not that established or is not that systematic because they haven't come into place with different professions discussing with the treatment plan of the patient. We haven't really done that here. I haven't have the answer where professionals come really together and discuss certain issues or certain diseases of the patient and how to treat that. And also, and that's the reason I think we are studying this, in order to finally soon enough we can really forge ahead and really implement this strictly, especially in healthcare, because it is really important for us to really provide the best possible care or best possible treatment for our patients. And we cannot do it alone because no man is an island. We really need other professionals, because that's why we have specialization, because we are not the master. One professional is not a master of all spades, and human has a complex system which is connected, and so as we professionals, we are connected in, and so as professionals, they are connected in many ways. And so I think that this should really be implemented strictly, the interprofessional approach to patient management. Also, to add, I actually was shocked that Ate, or Doc Jovel, because I called her Ate before, Doc Jovel haven't, although her sister is a dentist, she actually never have been collaborated with her. she haven't had any experience of collaborating with other professionals in her practice, although she's just a PGI as of now. But you can see really the lack of implementation of this one, or the lack of putting this into practice. And yeah, I think that we really should, we students should really take this subject seriously. And I am really happy that I'm one of the students who have the opportunity to know this, to know the importance, the principles, the benefits of this interprofessional approach to patient management, because now I realize how important it is, and I realized the risks, the damage that I will cause if I will not put this into heart and put this into my practice soon if I become a dentist. And now I am very eager that soon in my practice I will really apply the interprofessional approach to patient management. I will really tap different professionals when I need to in performing or in discussing about the treatment plan of my patients. And also I will extend my hand or extend my help to other professionals if they needed my expertise and knowledge. And I am very thankful for this experience. I am very thankful for the learnings that I gained out from this subject. I am just so blessed that I was able to know the different principles and the importance of this subject, and especially in implementing this one in our different practices.